Hello there, Dr. David Weintritt, breast cancer surgeon, and I'd like to take a moment to cover a topic, oncoplastic breast surgery. So, quite simply, this combines two very important elements in treating someone's breast cancer. Oncology, where we're making sure that we have an effective surgical plan to remove a patient's cancer, and plastics, which focuses on the appropriate repair, reshaping, or in some cases, reconstruction after breast cancer surgery. These are very important principles. We want to obviously make sure that we are treating someone's cancer and reducing their risk of recurrence, but at the same time, we want to make sure that patients are left whole and are left satisfied and happy, or in some cases even better off in regards to their appearance. Oncoplastic surgery gives breast surgeons the ability to not only successfully treat a patient's cancer, but maintain an appearance that patients are happy with, all the while reducing complications and improving surgical outcomes.